Understanding implantation bleeding, signs and symptoms.
Hello everyone. Today we are going to discuss an important topic that can often cause confusion in early pregnancy: implantation bleeding. It is crucial to understand the signs and symptoms of implantation bleeding and know how to distinguish it from other types of bleeding, like menstrual bleeding.
What is implantation bleeding?
Implantation bleeding is a light spotting that can occur when a fertilized egg attaches itself to the lining of your uterus. This usually happens 10 to 14 days after conception, so it can often be confused with a period. But there are some key characteristics that can help you distinguish implantation bleeding from menstrual bleeding.
What are the signs and symptoms of implantation bleeding?
Implantation bleeding tends to differ from normal menstrual bleeding in three key ways: timing, color, and flow. Timing. Implantation bleeding typically occurs a few days before your period would normally start. If you're trying to conceive, pay attention to any spotting that happens 10 to 14 days post-ovulation. This is typically the time when implantation occurs. Color. The color of the blood can also give you a clue. Implantation bleeding is often lighter in color than a normal period. It can appear as light pink or even brownish, rather than bright red. Flow. Unlike a regular menstrual cycle that tends to start light, gets heavier, then winds down, implantation bleeding is usually light spotting that lasts for a few hours to a few days. Remember, not everyone who gets pregnant will experience implantation bleeding. In fact, only about 25 to 30% of pregnant women experience it.
How can I tell if I am experiencing implantation bleeding?
If you're unsure if you're experiencing implantation bleeding or your period, you can consider the following. Pay attention to the timing. If the bleeding is occurring a few days earlier than your expected period, it could be implantation bleeding. Look at the color. Light pink or brownish discharge is more likely to be implantation bleeding. Note the flow. If it's lighter and lasts less time than your typical period, it might be implantation bleeding. However, if the bleeding is accompanied by intense cramping, or if it gets heavier rather than lighter, this could be a sign of a problem, such as a miscarriage or an ectopic pregnancy. In such a case, you should contact a healthcare provider immediately. That's it for today's discussion on implantation bleeding. We hope that this information will help you understand and identify the signs and symptoms of implantation bleeding. Remember, when in doubt, it's always best to consult with a healthcare provider. Thanks for watching and take care.